Hi, my name is Hoongyun Jung. I am going to talk about language disorder in this video. First of all, I will talk about the definition of language. There are lots of different definitions of language, but according to Cambridge Dictionary, a language means a system of communication consisting of sounds, words, and grammar, or a system of communication used by people living in a particular country. There are about 7,000 different languages in the world. According to Australian Bureau of Statistics on 2017, quite a lot of people speak a language different to English. 72.7% of people use English only at home, which means the others use different languages at home. Mandarin 2.5%, Arabic 1.4%, Cantonese 1.2%, Vietnamese 1.2%, and etc. Now you know the definition of language and briefly know how do we use it around us and in the world. From this slide, I'm going to talk deeply about what is a language disorder, also known as aphasia, etiology, cause, difficulty, and treatment of aphasia. Definition from NIDCD. Aphasia is a disorder caused by damage to the part of the brain responsible for language in most cases. Left hemisphere of the brain are affected. There are mainly two types of aphasia. First, receptive aphasia, also known as Broca's aphasia. The other one is express language disorder, also known as wrinkle aphasia. According to Nodam et al. 2012, aphasia caused by a problem to preventricular or white matter or corpus callosum. Since the abnormality of these areas are most commonly reported from people with language problems. The white matter around the ventricle contains the most important intra-hemispheric connection between the language area of the frontal and temporal lobes. Therefore, injury or problem of this area associated with disrupt language pathways and aphasia as a result. Broca's aphasia is the most common type of aphasia. People with Broca's aphasia have damage primarily affects the frontal lobe, while people with wrinkle aphasia have damage primarily affects the temporal lobe. People with Broca's aphasia cannot understand the words they hear or see and have difficulty finding suitable words to describe objects, places, or events. While people with wrinkle aphasia know what they are trying to say, but they have trouble to say it. And for both types of aphasia, the people cannot read, write, or understand speech. According to Peterson et al. 2004, the most common cause of aphasia is a stroke. Stroke is caused by the blockage of a rupture of blood vessels in the brain, which can lead to brain cell death or damage to the area control language. The other two, head injury and neurodegenerative, are less common cause of aphasia. They usually occur together with other problems such as memory loss or confusion. There are a couple of treatments considered to use or currently using, such as doing nothing, speech-language therapy, drug therapy, and transcranial magnetic stimulation. Some of the trauma resolve naturally as the times go, while some cases they actually need intervention to treat the disease. Speech-language therapy is most commonly used, but to achieve maximum result, the people around the patient, such as the health clinician and family members, needs to participate and engage the treatment together. Transcranial magnetic stimulation therapy and drug therapy are not proved yet. Kedar et al. 2014 showed some effectiveness of transcranial magnetic stimulation therapy after 2 months of the therapy. However, they admitted the limitation of the studies and mentioned further studies are needed to confirm the result. Also, drug therapy showed some effectiveness, but still it did not show any effectiveness better than speech therapy. Aphasia is not an easy disease to treat in short time. It needs time, money, and effort from surrounding people. For the people who is suffering aphasia, lots of attention is required since the speech therapy is still one of the best intervention so far and also for them. In the future, some of the better treatment should be researched, invented, and approved to improve their quality of life. Thank you.